My colleague Ibrahim Abubakar has been on the streets of Kumasi observing adherence to the COVID protocols in that part of the country. He joins me via Zoom. Ibrahim, would you say that the situation has changed from what we've known over the period in terms of the adherence to the safety protocols?
Well, yes, I can confirm that there has been an improvement when it comes to the compliance of, especially the wearing of the nose mask. Just last week, you move around here and you can hardly count about 10 people nose masks. But currently, as you see at the background, at least we are not getting 100% compliance, but I would say it's around 60 to 70%. And this morning, it has even shot up because when we came to the central business district, what we have seen is that a lot of security personnel have been deployed within the central business district of Kumasi to ensure strict compliance to the wearing of the nose mask. So what they are doing is that they are not arresting anybody. When they meet you without the nose mask, they have to force you for you to buy. And a lot of the people, interestingly, they have the nose mask in their pocket, or I would say in their bags.
And Ibrahim, on the back of the press conference by the Regional Directorate of Health yesterday, where they outlined the cases and the current active case counts in the region in terms of those who are in hospital, those who are receiving treatment, etc., would you say the latest action we're seeing on the streets of Kumasi is a fallout of that press conference that happened yesterday, convened by the Director of the Health Directorate?
Well, Komla, it's possible, but because even with the schools as we speak, the number has reduced. Yesterday, we were told that some of the students were in critical condition, but as of this morning, we are being told that they have been treated and discharged. And when we move to the various schools, what GS has done is that they have isolation centers, doctors for them to be able to attend to the students. But the challenge has to do with the basic schools. Because they commute from home to school and they do not have any boarding facilities, they have to move around with the virus. That's why the GES, or I'll say the Regional Health Directorate, is telling parents and school administrators to redouble their efforts so that we ensure strict compliance with the wearing of the nose mask. At least if the other protocols are not even observed and we have everybody in nose mask, then we have high chances of reducing the virus. Because as we speak, we have the Delta variant there, and it has high transmissibility. So when one person is affected, within the couple of some few minutes, it is likely he can affect 10, 15, or 20 people with it. So that's why they have also intensified their campaign. The police has also come in to make sure that everybody will put in on the nose mask so that we will be able to contain that.
All right, Ibrahim Abubakar, my colleague in the Ashanti region there. Let's cross over now to the Western region capital, Takoradi, where Eric Yaweje has also been monitoring the adherence to the safety protocols there. Eric, would you say the situation is different where you are from what is happening in the Ashanti region as we have it now?
Kamala, the case is very, very different from what Ibrahim reported moments ago. I'm currently at a makeshift market here in Takoradi. You know, the Takoradi market circle has been pulled down for rehabilitation. So this market is serving as a makeshift market whilst contractors work on the 30-month project for the new Takoradi market. So these traders here were brought here and charged to ply their trade in the strictest of compliance to all the safety protocols with regards to wearing of nose masks, social distancing, and all that. For the social distancing, I must admit that it is quite commendable because before they were brought here, there were markings on the floor to indicate exactly where you must put your store, just so you'll be able to observe that 2-meter distance. So that is quite commendable. But for the wearing of the nose mask, it is very, very abysmal. If you pick 10 people, you can say it is only one person who is wearing the nose mask. That even the person is not wearing it appropriately. The thing is drawn to the chin. So I can report here that when it comes to this makeshift market, wearing of nose mask is very, very abysmal. Before I came on air, Kamala, I spoke to a couple of the traders, and they have very interesting and very reasons as to why they are not in the nose mask. Some still complain that the nose mask kind of suffocates them when they put it on. Others are also saying that they prefer certain brand of the nose mask before they will be able to wear it. For instance, this woman here told me that for the normal nose mask, she's very, very uncomfortable in them. But the ones for the babies, when she wears it, she's okay. I asked her why she's not wearing it, and she told me that it's expensive, 12 cedis. So she can't even make 20 cedis in a day. So for her to spend 12 cedis on nose mask alone, she can't do that. Again, I spoke to another lady who actually has bought a pack of nose masks, but she told me that she's yet to wear it. So the reasons are very interesting and varying. What we do also know is that when we spoke with officials from the health directorate, they told us that the Western region, there's no case of the Delta variant here in the Western region.
All right. Thank you very much, Eric Yawije, my colleague from the Western Region capital, Takoradi, there speaking to us. Dr. Michael Roxon-Leje is Deputy Director in charge of Public Health of the Ashanti Region Health Directorate. He's joining us for a conversation around the surge in cases in that part of the country where we understand several hundreds of individuals are disregarding safety protocols. And we know Kumasi has become the hotbed with many new infections and subsequent deaths. Where did we go wrong? Dr. Roxon, thank you for joining me. I want to imagine that the directorate is having to go all out now to ensure that the residents in the area, in compliance with the protocols, simply wear their masks and observe the other social distancing protocols.
Good afternoon, and good afternoon to your viewers. What we are doing, or what we have been doing since inception of this pandemic, is to advocate for enforcement is in the ambit of the security, and we are fully backing them to take actions with regards to ensuring that people wear their mask and also ensure that the protocols do work. But we are still advocating that people adhere instead of complying, because adherence means that the person understands and is willing to even do the needful when no one is looking. But compliance means somebody has to stand on you with some force to do what is right. And as soon as that force is removed, people go back to their usual state. So alongside the enforcement, we're still appealing to people to adhere and see what we are seeing, because the figures are put out every day. People are falling ill. Admission is rising gradually, and it's not a situation that we are happy with in Ashanti region.
And the president in the last address mentioned that funeral and wedding receptions are banned henceforth, so we can attempt to contain the spread of a virus. In the Ashanti region, we know that a lot of activities go on in that part of the country. From what you are gathering as a directorate, is it the case that the individuals are simply flouting these regulations, or they, as you have said, do not understand why they should adhere to them?
You know, as at last weekend, before the president spoke, things were going on as usual. People were having their parties. The funerals went on. Much had not been. As at the start of the week, we go out every day to look at adherence to the protocol, especially conduct face mask usage survey. Nothing has changed much, but we are very optimistic that it will go down very well. By close of the week, we will see significant improvement. And for the funerals, as to whether people will heed to the directive, we will see this weekend, because that is the peak of such activities. So
I was going to let you go, but touch on this for me and tell us the essence, why people should adhere to the protocols. Nationwide, we understand ICU beds are running out and the facilities are getting overwhelmed. For this reason, I'm sure you have a strong word for the citizens and the residents in the region to keep themselves safe.
Yes, thank you very much. We will continue to appeal to the citizenry, especially in our region, because we don't have enough beds at the ICU or at the treatment centers in our region, put together, all our beds for treatment of COVID-19 will not be up to 150. And it's not just beds we need. We need beds that are functional with the gadgets that come with it. Currently, one critical equipment, CPAP, the mask for it, globally is not available. So it means that you cannot expand the ICU care beyond a certain limit because the CPAP mask is a very critical gadget that you will need. We can prevent the numbers from increasing at the ICU by adhering to the basics. Primary prevention, that is within the protocols that have been set in place. And everyone has the capacity to adhere to these protocols. It is within our hands. Wearing of mask is within the power of the individual. Ensuring that you are not close to people, physical distancing is within your power. Hand washing and sanitizing or hand hygiene is within your power. Respiratory hygiene is within the power of the individual. But unfortunately, we are seeing that people are not adhering to the extent that we need someone to crack the whip. For me, it is not a good sign because we are all individuals that see this situation that we are in. So we plead with people to adhere because adherence has paid off a dividend. In the first wave, we cried out, we both went back to the basics, we did what is needful. We saw the numbers coming down.
All right.
We went to a second wave after December, everything the same, and then we came down. So we can also do the same in this third wave so that we can nip it in the bud.
Thank you very much. You heard there Dr. Michael Roxton. He is the Deputy Director in charge of Public Health at the Ashanti Regional Health Directorate. They're speaking to us.